Welcome all. We're all excited to be here. We have a record number of registrations today.
Geratophobia is the illogical, unreasonable fear of old people and of getting old. And we have an epidemic of it.
Maggie Kuhn, co-founder of the Grey Panthers and one of the great leaders and spokespersons of our time, is making a unique contribution to American society. She is challenging age-related prejudice and generating national support for the needs inherent in the aging process, from the United States Senate to the American Medical Association. With her extraordinary energy and insight, Maggie Kuhn portrays the admirable spirit, commitment, and new image of aging in America.
Our focus is not on old folks' issues. We're not a gray lobby. We're not working for the special interests of old people. We're working for the special interests of people, humanizing, hopefully, and healing our society of its divisions.
Thank you, Emily, for playing that. Greetings to all. Welcome. That was a clip of our founder, Maggie Kuhn, in case you've never heard her speak before. So I'd like to say good afternoon to some, good evening to others. Hello, welcome friends, neighbors, and supporters of the Grey Panthers to our November 26, 2024 Thanksgiving Week Transformation Tuesday. It's been a roller coaster November for us here in the USA, and it's a comfort to see so many friendly faces here again. This month, we're excited to host Dr. Hubum Jang from the World Health Organization. Dr. Jang is based in Geneva, Switzerland, and he's just returned from an extended journey through China for the WHO. So we're grateful to him for making time for us to offer an overview of long-term care through the lens of ageism and through the lens of jet lag. I believe most of you know me. I'm Michelle Arnaud, and I thank you for your support for the Grey Panthers movement, which was founded by Maggie, whom you just saw in the clip, in 1970. So to recap, Maggie envisioned our mission to combat ageism and promote intergenerational contact, which is what we strive to do every month with our webinar series, Transformation Tuesday. Our intention is to provide a safe space to change the narrative for how ageism impacts our world, with the goal of making a positive difference. What Maggie could not have envisioned and would have embraced is how we're meeting on Zoom every month, and we're able to connect people from the four corners of the world. Since the summer of 2021, Grey Panthers everywhere have convened on the last Tuesday of the month to have this conversation. But I'd like to point out, next month, please note we will not be meeting because the last Tuesday of this year falls on New Year's Eve. And although we love meeting with each other, we're going to do something different and take a break. So just to repeat, there will be no webinar next month, and we'll meet again next year on January 28th, 2025. All our webinars are recorded and available on the website gpnyc.org, posted by our talented tech manager, Emily Trask. So if you find yourself missing Grey Panthers on New Year's Eve, please feel free to listen to one of our past webinars. So just a brief bio about Dr. Jang. He's a global health practitioner and graduate of Seoul National University and Harvard T.H. Chan School of Public Health. And currently, he's a medical officer responsible for long-term care at the Aging and Health Unit at the WHO headquarters in Geneva. After attending one of our Tuesday webinars last year, Dr. Jang reached out to Grey Panthers and invited us to participate in an informal gathering of civil society organizations. and to share our experiences about older people and caregivers. And ever since that date, we've remained in contact. Dr. Zhang is committed to exploring future care systems on the global level, and we look forward to hearing his insights today. Thank you, Dr. Zhang, for clearing your calendar and joining us from Switzerland, where it's 8 p.m. So I will pass the mic to you. Thank you.
Thank you so much, Michelle, for your kind introduction. So as introduced, my name is Hyobom Jang. I'm a medical doctor and public health physician from South Korea. And I have been working inside WHO for, almost 10 years and have been recently focusing on my work on healthy aging. I'm currently a responsible officer for long-term care, which is one of the 4 action areas of UN Decade of Healthy Aging. So let me just briefly share my screen and sorry, just give it a second. Yes, I got it. Sorry for the delay. Can you see the screen now?
Yes.
Thank you. Yeah. So this short presentation is about overview of our work on global level strategies and priority project and task on what we do on healthy aging and particularly on long-term care for older people. And I thank you and Michelle and Jack and everybody in the Grey Panthers again for this opportunity to be connected with the audience, which is such a rare opportunity for WHO to hear what you think from the ground. And I really look forward to discussions. So my presentation will not be too long, and I look forward to hearing your thoughts. Thank you. So maybe not many of you are aware of what WHO is doing on healthy aging and how we define long-term care. Maybe it'll be helpful to start with some introduction. And then what we hear from the member states, what they think about common challenges and opportunity, also fed by our experts and stakeholders, like Grey Panthers, as we interact with the civil society partners, what will be the opportunities and priorities. And then what we have analyzed so far about the global trends on aging and care provision. What are the recent development status, and what are the more importantly emerging key issues in the area of long-term care? And then what has been our response from WHO? What does WHO framework suggest as a key elements for long-term care systems? And then what WHO has been communicating and advising countries with some considerations and action points when they want to develop and improve long-term care systems. So our work on healthy aging is based on this fact that people are living longer, but not necessarily healthier. We all know that in most of the countries and around the world, the life expectancy has increased very rapidly. People are living longer. But it's not the same for healthy life expectancy, meaning that people are not enjoying enough health and well-being through the period that they can live longer than before. So from this problem statement, the WHO concept of healthy aging started So oh, you can imagine that WHO has been traditionally tried to tackle diseases, eliminate smallpox, or fight dengue fever, malaria, tuberculosis, AIDS. That has all contributed to the increase in life expectancy. But we all have now, most of the countries have aging population. What about them? Do we still just try to prevent mortality or just to make them live longer? No, we want them to enjoy their health and well-being in their old age, which means they can maintain their functions. So here comes some of the uh, different concepts. We say that individual older persons or individual person has an increased capacity, which is like a physical or mental capacity of individual, which you can imagine closer to the concept of health, individual health. But this increased capacity interacting with the environment surrounding an individual, like the home, communities, broader environment, and also societies, policies, everything. And then with from this interaction between individual capacity and environment, that defines how much a person can function. We call it functional ability. So this figure and graph might be even not really familiar to you. You can imagine that someone's individual capacity and function would increase when they age, but may start slowly decreasing as the biological aging progress. But of course, these trajectories and uh, the course is really heterogeneous and unique for each individual. But in general, even though people may have high and stable capacity in their younger years, but in the later in their life, the decline of this function and capacity starts. And with some events in their life, such as illness, accidents, disabilities, you may lose your function. But the concept is if you can provide appropriate support at the critical moment and also throughout the later stage of life, then individuals can still try to maintain their functionality and then enjoy their healthy aging in where they live. So a concept of healthy aging influence the global community where the United Nations endorsed the plan for the decade of healthy aging from 2021 until 2030. This global initiative has action areas, enablers, and a principle of putting all the people at the center. There are 4 action areas under this UN Decade of Healthy Aging. First, changing how we think, feel, and act towards age and aging. This is about really tackling ageism. And second one is to deliver health and care services. How could countries and health and social workers provide integrated care in the primary healthcare services responsive to older people? How they can better understand the life and needs of older people and their families, and then integrated such support in their existing health and social care systems. And the third is providing access to long-term care for older people who need it. This is what I'm going to explain more. And then the final one is to ensure that communities, such as cities, local communities, and environments, can foster the abilities of older people. So making age-friendly environment, age-friendly cities, and age-friendly networks. And there are some enablers that we have but as a principles, the important principles of the decade of healthy aging action plan, that we, not only WHO or UN, but countries and every stakeholder should hear the voice and try to meaningfully engage of all the people, the families and communities. This is a very important change, the shift in our approach. The WHO and UN, as you can imagine, are usually working with the national governments. And for the case of WHO, we have traditionally, historically, closely work with the Ministry of Health in countries. But under this UN Decade of Healthy Aging, we emphasize that we should listen to the people on the ground and what they need, what they insist, what they value, what they would like to expect from the countries and the global community. And to enable this overall effort, we, WHUN, will help countries to develop leadership and capacity. We are here as a platform to connect stakeholders, including you, civil society partners, and individual persons. And then, of course, we work on data research and innovation on all the people. Let me just briefly provide a concept of long-term care we think. Of course, the long-term care, the terminology itself is, has taken different forms in different countries. In the US, we know that it is called long-term care, service and support, LTSS. And in other countries, it is sometimes called aged care, but in general, it is called long-term care. And then many people have the perception is long-term care is only about long-term care facilities. But that would mean only residential care. But we identify and describe long-term care includes a diverse continuum of integrated services beyond basic needs, beyond just residential care settings. It's not just institutional care. It could be provided in homes and communities where people live. And then it is also includes all the health and social care services to meet the needs of individual or the persons whenever they have some need. And then long-term care, whatever it takes, it should respect each person's rights, values, preferences, dignity, and independence. And then also there has been critical emphasis in our position that not only the people or the people who receive the services, but also the families and caregivers who are informal caregivers, unpaid family caregivers, and family members. They need to be considered as important partners and companions to care. Their needs has to be identified together and they have to be supported. So we have communicated the member states what they think about challenges. Of course, not many countries have formal long-term care systems. It's always, missing. The public provision or public financing is not sufficient, and the coverage of long-term care services is not enough, scarce. It's not integrated in healthcare systems. It is not identified essential interventions. And still, families, women have a lot of burden on caregiving, even in high-income countries. The care workforce is always not sufficient. They are underqualified, undertrained, and undervalued. This care job is not considered as a decent work. The health and social ministries and sectors, they don't work together necessarily. They're fragmented. The services and coordinations are disintegrated. And of course, each society has its own heterogeneous structure and social value about what they think about care. Not all the countries regard providing care as a state responsibility, although healthcare services are being provided in more accountable ways. But there are opportunities which I would mention more specifically. So this has been our progress. We started 10 years ago from the World Report on Aging and Health, where we introduced the concept of healthy aging. And throughout the following 4 years, implementing WHO Global Strategy and Action Plan, finally the UN Decade of Healthy Aging started 4 years ago, which identified long-term care as one of the action areas. And since then, WHO has produced some key technical guidance documents, such as the long-term care framework and long-term care US package. I will explain more. The positive things are that we are seeing as a WHO, we can observe and identify the emerging, very rapidly growing interest in this topic about long-term care. Of course, most of the countries will face population aging, regardless of their income level in the near future. But we could imagine how the COVID-19 pandemic has influenced this interest, because the pandemic has revealed the weaknesses in existing long-term care system. Even in high-income countries that they believed they have such a good systems. But after that, every country is trying to revisit their long-term care policies. They're trying to make more robust systems and then also learn from each other's experiences. It has been decades, but in some countries, it has been more recent. Focus on shifting their priority to provide residential long-term care, but towards more home and community-based care, which is aligned with the aging in place principle. So the motivation of national governments was to really reduce cost, because residential care is expensive. But of course, no one wants to go to long-term care facilities when they can still enjoy their health and well-being in their houses with their families and friends. So this is to respect individual preferences, values. Globally, there have been growing movement, activism on care and support agenda. There has been advocacy on the rights of older persons and women, families, and the need for, improving the care work, vitalizing care economy, and then how we should support informal caregivers. And of course, the existing health and social care systems are trying to integrate care for older people in their systems. So this is what we suggested a couple of years ago. Our framework provided some key elements and systems for a sustainable, equitable, and affordable system to provide long-term care. Maybe some of you might be feel familiar with this infographic, because that benchmarked the WHO's 6 components of health system strengthening framework. But you can imagine that for a good system to provide long-term care, you need such components like governance, financing, workforce, services, but also information research. So if we look at inside this guidance document, for example, we describe some of the common problems and challenges in the existing systems from countries, but also we summarize the vision and the future direction that countries want to transform their service provision. Like they want to integrate, they want to make services more person-centered. Individual care plans should be established. Services are better provided at the community level. We need to provide options and choice for aging in place. And then countries and key stakeholders can take some actions, like to assess the needs of older people, to define package of long-term care services, redesign and transform integrated care, and having quality standards for care. Earlier this year, about 6 months ago, we published a very long-awaited publication, which is called The Package of Long-Term Care Interventions for Universal Health Coverage. In this document, WHO, for the first time, tried to set some grouping or try to define what are the core interventions that every country should consider to provide, and more importantly, funded or supported by the public sector, by the government, not just letting on families or depending on private institutions. We also try to set the principles of person-centered integrated care or long-term care, and then we suggested some topics that education and training should be provided to not only care workers or professionals, but also informal carers. So this is one of the important issues about care workforce and carers. There are such a different categories of workers, including informal unpaid workers, including family members, partners, and relatives. We may not call them workers, but they still provide care work. So it's not easy to set a clear boundary. You can see the screen. This is more like a broader spectrum rather than having a clear categorization. This is one of the challenges, but ILO, International Labor Organization, and WHO, we have been trying to understand their jobs and working conditions. This is one of the very positive development, how WHO is working with the countries to advocate this long-term care agenda. The WHO Region Office for the Americas, which we know as a PAHO, has been recently working with the countries, and the member states of PAHO passed, just endorsed this policy on long-term care, which is really the first case inside the WHO system and the United Nations. This particular policy emphasizes the role of the health sector in providing long-term care as part of the universal health coverage of a life course. So it recommends the member states in the Americas to strengthen their governance and accountability, to strengthen workforce capacity, to strengthen organization and delivery of person-centered integrated care, and increase and optimize sustainable equitable financing, and to strengthen information system to better understand the data and the statistics. Earlier last year, we published the first progress report back on the progress of the United Nations Decade of Health and Aging. If we look at slightly over what we said about long-term care in this report, surprisingly, many countries reported that they have some kind of policy or strategy or framework on long-term care. This is not exactly verified, but when we ask another question, do you have adequate resources to implement what you have written down in your policy? Only about 1/3 of countries said they have adequate resources, meaning not many countries are actually implementing or providing necessary care services to people. And then we hear more and more, still so many countries depend on informal caregivers, families, which we know, they all know this is not sustainable. When we ask about uh, providing any support mechanisms for informal unpaid carers, only 16% of low-income countries said they have such programs, which means most of them are neglected. And the progress still slow and little. And some services like palliative and end-of-life care is not being provided. So this is the final slide. We have been discussing with the countries and global experts what should be the priorities. So there has been a need to establish some common global level long-term care standards and to better understand the situation of long-term care in countries and provide some training and capacity building opportunities with support resources for carers and care workers. And of course, as a UN and WHO, we are supporting countries and stakeholders to share knowledge and practices about different programs and approaches and models on long-term care. So thank you. I hope this has made some general introduction understanding, and I'm looking forward to hearing what you think and your ideas, sharing your experiences. Thank you. Thanks so much.
Well, thank you for this very in-depth introduction to what WHO is doing. There's a question from Barcelona. Most innovation or action proposals for aging are meant for future old people, not current ones. What can we do in this respect to ensure that current old people's needs are covered in the next years or even the next year? For some, it's too late. How would you reply to that?
Yeah, thanks so much for the question. Actually, that's the main reason that WHO and other UN agencies agreed to start the UN Decade of Healthy Aging to increase the attention on aging issues of the current generations, not just to provide or ask countries to prepare for the future, but urgently to take actions to provide care to all the people right now. Of course, you can imagine this is not happening so fast, and still many countries are just trying to build systems level evidence. But yeah, we are also engaging with the local stakeholders and actors to do some actions within their communities and cities to make changes. We hope, and as a WHO and UN, we really try hard to accelerate the progress and urge the countries recognize the urgency of this situation. Yeah, and we would like to depend on you, the people, and the civil society organizations to really push your country's governments and key stakeholders, policymakers, make actions forward. Thank you.
A question from Kenya. Somebody would like to know, is there information on the General Assembly 79th session outcomes and resolutions in regard to the development of the UN Convention on the Rights of Older Persons? I think there has
Yeah,
been some activity.
yeah, this open-ended working group on aging has been working on the rights of older people for many years. That has recently completed. I think we have to see. Sorry that I cannot provide any more accurate information. Our level of intelligence is on the same page like you, but yeah, we can actually, yeah, we'll be happy to provide any further information once it's out.
I just wanted to add on to that in terms of, yes, you're right that the open-ended working group on aging has concluded its efforts here in New York, and it's now shifted to the Human Rights Council in Geneva. So further discussions on the protecting the human rights of older people will be happening in Geneva, and that's kind of gearing up now.
Yeah, I can add that the Geneva-based organization, the Office of the High Commissioner for Human Rights, has been taking the lead on the discussions of the rights and care of older people. And then there has been recently such a good discussion and workshop on the care and support, including care for older people, including long-term care. And then we see that there are emerging interests on the broader agenda, care agenda as well.
Someone is pointing out that there's poor level of adherence to the existing international law by nearly every country. So I guess the question is the current system where each country prioritizes or does not prioritize rights, what can we hope for? I guess it's this convention. Will the convention be the magic bullet? I guess so.
Mm.
There was, okay, somebody in the US has a question about motivating quality of long-term care and helping older adults live healthier lives in a country such as ours, where profit is seen as number one. So right now, long-term care is most profitable when there are fewer staff members than might be optimal. I don't know if that's a question that you can answer, but
Yeah. This is one of the points we try to convey to countries when they build new systems or shift the priorities of their systems, the existing long-term care system. Let me tell you an example. I recently have been working with China, People's Republic China. That country is a middle-income country and with a large population. It's trying to build national level long-term care systems. In China, there have been 10 years of experience in local level experiments or pilots. And then they are trying to consolidate the lessons and build national one. We, WHO, convey the messages that you need to really have a strong foundation of the public sector presence in the system. You shouldn't just depend on the private institutions or for-profit industry to take advantages of the national insurance, which has been happening in other countries in Asia, such as Japan and Korea. Even though you may have some public funded financing schemes, if your provision is totally dependent on private entities, then you cannot ensure the quality. That has been one of the lessons from neighboring countries. And yeah, that was our key messages. And then we'd like to have more evidence of this from the US and other countries. and then reflect in our future guidance, such as long-term care standards. So we'll be very happy to hear such good evidence and cases that we could show the governments, including the US.
So following up on that, how can civil society encourage the enhancement of long-term care at a systems level as well as at local or family level?
I think this is why we put the enablers about hearing voices and meaningfully engage the older people and families. Of course, not every country has such a mechanism to hear voices and that make people participate in the process, but this is still the principle that I think not many WHO initiative or UN initiatives is really recasting this approach. And then in our guidance documents, we ensure that people are participating and then at least we have some consultation with them, like we tried with the great pandas in the past. What I believe is that this is UN level guidance, a global level aspirations and principle. Of course, this is open to the public and this is not just technical document provided to national officials. People can say, civil society can say that this is a UN document and then they want their national governments or local governments, cities and communities to adapt. We can share many examples. They don't necessarily wait for the WHO to provide such technical support. Many cities and communities has already started adapting, translating our guidance, and then taking some actions, which we can see whilst to be observing, around the world. So I would encourage that you take the actions, and then we were happy, how our resources could be utilized. And we would like to also hear the voice from your civil society. What kind of advocacy or policy technical guidance would be further needed?
A question from Belgium. How does ageism play out as a structural challenge to the development of long-term care systems? And what are some strategies that the WHO proposes to address the issue?
Yeah, that's a good question. We know that ageism is everywhere. In our decade approach, we especially focus on the ageism in the health workers, for example, that we need to really tackle the ageism in healthcare settings. We have to address the ageism in the infrastructure and the community environment. But also, I think this ageism is also affecting the policymakers' view about the need to establish such a nationally or publicly funded system. If the healthcare professionals do not think, or the people need to receive such appropriate care because they are too old, or it's natural for them to ill, it doesn't work. But the same narrative can go apply to national policymakers. They do not necessarily want to finance the care. They still want to depend on the families, which is free and which is, of course, affecting the lives and works of the women, family members. It is missed opportunity. But of course, it has not been easy in many countries to argue that investing in care and enabling the older citizens and their families to work If if they receive better care, then they'll be more beneficial for overall economy and society. But there are some narratives and arguments such as that. And then that's also helping to tackle this wide perception or typical, stereotype.
A question from Iraq. The question is, how can we develop cooperation with the WHO in Iraq, especially since we believe that collaboration with NGOs in this area is not at the desired level?
Yeah. When we had our consultation meetings, we communicated with our WHO colleagues in Iraq, with health officials in Iraq. We can say there has been more increasing interest, and even uh, those in like humanitarian situation or conflict affected areas, still older people are living, even they are even more affected. So they are more one of the key vulnerable populations during the conflict and humanitarian situations. We have seen that in Ukraine as well. And then we are hearing more about how climate change is affecting the older populations in such countries. So yeah, recognizing the special needs of older people and how the disruption in care is affecting them and their family members should be more recognized. If you can advocate, if you can communicate with your national governments on for such a need, yes, I think they will already make some differences. And whenever the UN or WHO has opportunity, we always encourage the government to invite civil society groups such as Older People's Association in the country. So hopefully, yeah, there should be more chances.
And there's a question about climate change. In what ways is climate change exacerbating existing environmental health risks? And what actions is the WHO prioritizing to mitigate the impact and protect vulnerable populations?
Mm. Is this question specifically on older people or is it on
Well,
general
we
on
did
climate
have,
change?
in Switzerland, there's a group of older women who sued the government because climate change is impacting older women more heavily than other populations. So I guess that might be the bridge.
Yeah, that's a globally, recognized, yeah, very powerful example. And then there has been studies and research and collaboration with academic institutions and WHO on the impact of climate change, such as heat waves. If the effect of heat waves during seasonal changes, how it affects all the people, and what could be the measures to mitigate, such as providing air conditioning. But of course, there has been also arguments that we should also look at the impact of cold weather, due to the climate change. Yeah, I would say the evidence for climate change and its impact on health is quite evident. It's already been there for many decades, but there not be sufficient evidence on the impact on older people. Maybe they have been under recognized in countries. I would say we need more evidence, but of course we don't need to wait for the evidence. We should take actions like we heard, yeah, from this very courageous group from Switzerland.
Uh, Someone in Nigeria is also asking about how can people be enlightened on the topic of ageism, and how can we get support in order to carry out a project to support older persons?
Mm,
That's a sort of big question. I don't.
yeah. There have been some resource guidance tools and materials. I can share with Michelle and whatever we have talks about ageism, and then also there are some channels and platforms that you can participate. So that might be one of the ways that you can be engaged, and their education materials.
Yeah, there's a general question. How can efforts for aging community, I guess, to protect them be more structured, which is if there is some sort of guidance that you have, is there anything written that the WHO can share that we can share?
Sorry, can you repeat the
So
question?
the idea is about ageism, I guess, in general, what can communities do to enlighten each other on the topic?
Well, let's also look at that from the perspective of long-term care.
Yeah, I think though this currently existing guidance on ageism is more on how we can do campaigns and advocacy in the more broader societies. But our one of the next steps and requested resources include how ageism can be recognized and tackled in health and long-term care settings by the health and care workers. So that might be one of the uh, products that WHO would develop, yeah, before the end of UN Decade of Healthy Aging. Yeah, and then I think that will be also helpful to tackle aging in every care setting.
So what will follow the decade of healthy aging? Will it be the decade of super healthy aging? Are we going to achieve all of our milestones?
Ay, ay, ay.
Mm.
Ay, 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 ay.
This is such a first global level effort to make older people healthier. There has been no initiative or target before this approach. So, although we can already expect not everything will be achieved or happen as we positively expected, but still it's influencing, affecting our mindset, our ageism, our interactions with the countries and policymakers, and also more importantly, it's affecting not only existing but also the future generations. So yeah, we are positive that this may not be uh, the solution for everything. It's not a silver bullet, but it will still make some changes to the future and hopefully more within the current decade. Maybe we
I,
can take more global level priorities such as the post millennium development goals may have more explicit goals on healthy aging and long-term care, which is currently missing.
right. Uh, I wanted to note Gina Rossi had said in terms of options for addressing ageism, she said the WHO toolbox for ageism is fantastic. So that is kind of a response to one of the questions.
Yeah, can already share this link, the WHO toolkit to do campaign to combat ageism.
Great, thank you. Someone is commenting that we are healthy, but we would like more respect and inclusion. So that is the issue of ageism. So it seems that living longer has been achieved, but living healthier is the challenge, and with the support of the community. But in the US, the issue is finance. How to, as you pointed out, Dr. Jang, of course, the burden falls mostly to the family in the beginning. And then there are ways that are available that are less attractive and more expensive. And in my past job, the CSO that I worked for got funding for families to be paid in order to look after older adults, but it wasn't really a viable model. So really, we need more models on how to look after older persons in a dignified manner.
One of the things that I wanted to just reflect on Dr. Jang's comments forever is that what he's doing is like highlighting one of the omissions in the world's efforts to address healthcare and older persons. The issue of long-term care is always put to the side. And given the not just the number of people but who are aging, but the needs for addressing health, it should be higher on the priority. And the detail that the WHO has gone into with regard to health long-term care is obviously needs to be applauded. And it is a first step. It's not even a first step, it's an important step to first acknowledge and then implement. So I think that that is really a great, this has been a great opportunity for everyone to learn a little bit more and to put it on everybody's, a little bit higher on people's priority list.
And also, Dr. Jang, you said you just returned from China. Is there anything you'd like to share about your trip before we end?
Yeah. I was quite impressed by the key interest and enthusiasm of the stakeholders we met, including national level officials, city level officials, municipal governments, healthcare workers, care workers. They have been trying to do their best in designing new and innovative systems, sometimes referring and learning from other countries, but also trying to understand and contextualize their own situation. But also, it was positive that they wanted to invite WHO to provide and share more common standards and key common features of the long-term care policies, which we could, for each we could emphasize the importance of public level effort and provision and financing of long-term care, and then also the need to support informal carers. All the points and questions have been already being considered and discussed within the country, but the country was open to discuss and share with other countries. So that was one of the good examples of how a country could we work together, not only between countries, but also how a UN and multilateral systems could support such a national effort for a country with a very huge population. So I'm sure this will be a very interesting case and model for their own. Of course, this is different from your countries, different from United States or different America. But for those who are developing, in the very early phase of long-term care, yeah, that can be also one of the good examples. that we can all refer. And then they will share some of the lessons after 1 or 2 decades, what they have tried, what they have evaluated. So then there will be a continuous improvement in our systems. We never stop.
Thank you so much. Somebody's just written that he's a caregiver for his 100-year-old father. Oops, sorry, I'm losing, and has learned about multiple strategies. No, I guess, yes, to support caregivers. So we have lots of people on the call who've been on the caregiving side. And we really appreciate you taking the time to share all this information with us. And we'd like to invite you back maybe in a year when we're closer to the end of the decade of healthy aging. And we're all going to continue to age healthily. And I'd like to wish everybody a happy holiday, as happy as we can be. And we'll meet again on January 28th, 2025. So thank you so much. This recording will be on our website, and we look forward to seeing everybody in the healthy 2025. Thank you.
Thank you. Bye bye.
Bye now.